The CDC has confirmed the highly contagious coronavirus variant first detected in the United Kingdom, known as B.1.1.7, is now the dominant strain here in the U.S. Public health officials warn the country is on the brink of a fourth wave. Over the past week, hotspots like New York, Michigan, Florida, Pennsylvania, and New Jersey reported 44% of the nation's new infections. The White House is racing to get more people vaccinated. President Biden says all adults will be eligible for the shot by April 19th. And while the nation makes progress in its pandemic fight, on Wednesday, the director of the CDC said there are still reasons to be concerned.
While these rates of vaccination are incredible and so encouraging for all of us, trends are increasing in both case numbers and hospitalizations. Across the country, we are hearing reports of clusters of cases associated with daycare centers and youth sports. Hospitals are seeing more and more younger adults, those in their 30s and 40s, admitted with severe disease. Data suggests this is all happening as we are seeing increasing prevalence of SARS-CoV-2 variants, with 52 jurisdictions now reporting cases of variants of concern.
For more on this, let's bring in Politico healthcare reporter Alice Miranda Ollstein. Welcome, Alice. Thanks very much for being with us. So is the federal government taking steps to direct more resources and vaccines toward these COVID hotspots?
Yes, so like you said, they are racing to get everyone vaccinated as soon as possible, and that's taking a lot of different forms. That looks like opening up more of these mass vaccination sites run by FEMA in sports stadiums and county fairgrounds and other spaces that can handle thousands of people per day. But it also looks like directing more vaccine supply towards small federally qualified health centers, which by definition serve low income and underserved populations. And so thousands of those clinics are set to receive doses now. And they are pushing up the deadline for states to open up vaccine eligibility to everyone over 16 sooner than previously planned. And the hope is that all of this will outpace the spread of these new, more contagious variants, but they are stressing that vaccinations alone is not enough. They are warning governors and mayors against dropping precautions like mask mandates and restrictions on the size of gatherings, telling them to hold on for a little bit longer and pointing to the recent rise in cases. And they are saying that if we don't take precautions and maintain vigilance, that we do risk a fourth wave, and we do risk the rise of variants that maybe the vaccines that we currently have available cannot combat.
So state and local contact tracing programs are about to receive billions of dollars from President Biden's American Rescue Plan. How difficult is it, Alice, to get people to agree to using contact tracing to the point where it could be effective?
It's been very difficult. Throughout the pandemic, we've been reporting that many people are very resistant to sharing information with the local public health departments when they call and try to trace the spread of the disease. Where did people get it? From whom did people get it? And then reach out to people who might be infected and say, look, you really need to get tested and quarantine. There has been so much resistance that some states and areas have moved away from the practice and are really just encouraging people to do their own contact tracing and reach out to their own contacts. That happened a lot during the fall and winter surge of the virus when they were just overwhelmed and didn't have the manpower to reach out to all the positive cases they had to deal with. Now, some states are ramping traditional contact tracing back up, but a lot of public health officials that I talk to are also saying, maybe we need to rethink this. Maybe we need to rethink the entire practice of how we go about this to get more people to participate. Another major fear is the rise of tests that people can take at home or in the workplace, these rapid tests that are going to become more available in the coming months. The results of those aren't necessarily reported to public health departments. And as they like to say, they can't trace if they don't have a case.
Well, about 80% of K through 12 teachers have received at least one dose of the vaccine. Where do we stand, Alice, in terms of reopening schools? Will we meet President Biden's goal of getting most kids in classrooms within his first 100 days?
So it sort of depends on how we define the goal. A lot of schools are now open 5 days a week, and yet many students are still doing remote learning. There's a lot of fear among families about sending kids back to schools, especially in places where the virus is resurging and cases are high. Those same issues are also behind a lot of teachers and teachers' unions' resistance to fully returning to the classroom at full capacity. And so there are just a lot of difficulties right now and a lot of variation across the country in what schools are open and for whom.
Finally, Alice, European Union regulators say there is a possible link between AstraZeneca's COVID vaccine and reported blood clots. What more can you tell us about it, and how might it impact AstraZeneca's attempts to authorize a COVID vaccine in the U.S.?
Absolutely. So the European Medicines Agency did disclose recently that there is this possible link to blood clots, but they stressed that the risk of that happening from taking the vaccine is still much lower than the risk of not getting vaccinated and getting COVID. And I think it will be hard for governments and regulators to make sure that is the message that gets across. With so much vaccine hesitancy already swirling around, these reports of there being a very small chance that somebody could get a blood clot from a vaccine, people might hear that and not think in the bigger picture, it's still far, far safer to get a vaccine, even with these potential risks, than to not get vaccinated and potentially get COVID.
All right, Politico healthcare reporter Alice Miranda Ollstein. Alice, thank you very much.
Thank you.